Paronychia is an inflammation and infection of the skin around the nails on the fingers or toes. This condition can cause discomfort and pain, affecting daily life and activities. Understanding the causes, risk factors, symptoms, and treatments for paronychia can help you avoid complications and maintain the health of your nails. Causes. Paronychia can be caused by various factors, including bacteria, fungi, and viruses. The main causes of paronychia include bacterial infection. The most common cause of paronychia is a bacterial infection caused by staphylococci or streptococci. These bacteria can enter the skin through small cuts, cracks, or damage around the nails. Fungal infection. Fungi such as candida can cause chronic paronychia, especially in people frequently exposed to moisture or with weakened immune systems. Injuries. Skin injuries around the nails, such as cuts, bites, or improper manicure or pedicure, can become entry points for infection. Risk factors. Certain individuals are at higher risk of developing paronychia. Risk factors include frequent moisture exposure. People who frequently wash their hands, work in high humidity conditions, or frequently come into contact with water, e.g., chefs, nurses, cleaners, have a higher risk of developing paronychia. Poor nail care. Improper nail care, such as cutting the cuticle or improper manicures, can increase the risk of infection. Diabetes. People with diabetes are more prone to infections due to weakened immune systems and circulation problems. Immunodeficiency. A weakened immune system caused by chronic diseases, immunosuppressant medications, or HIV infection increases the risk of developing paronychia. Signs and symptoms. Symptoms of paronychia can vary depending on the stage and type of infection. Common symptoms include pain and redness. Inflammation around the nail, accompanied by pain and redness, is the first sign of paronychia. Swelling. The skin around the nail may swell and become tender to the touch. Pus discharge. A bacterial infection may cause pus to ooze from the affected area. Nail discoloration. The nail may change color, become dull, or deformed. Chronic paronychia. In chronic paronychia, symptoms may be less pronounced but persistent. The skin around the nail may become thickened and scaly. Treatment. Treatment for paronychia depends on the type of infection and the stage of the condition. Prompt treatment helps avoid complications and speeds up recovery. Home remedies. In the early stages of paronychia, warm saline baths can reduce inflammation and pain. Soak the affected finger in warm water with added salt several times a day. Antibiotics. For bacterial infections, a doctor may prescribe oral or topical antibiotics. It's essential to complete the full course of treatment to eliminate the infection. Antifungal medications. For fungal infections, antifungal creams or pills may be prescribed. Treatment can take several weeks or even months, depending on the severity of the infection. Surgical intervention. In severe cases where a pus abscess forms, surgical intervention may be required to drain the pus. This procedure is performed under local anesthesia and helps quickly alleviate symptoms. Prevention. To prevent recurrences, it is important to maintain good hand and nail hygiene, avoid damaging the cuticle and skin around the nails, and wear gloves when working with water or chemicals. Patient stories. Personal experiences with paronychia. Stories of people who have dealt with paronychia can be a helpful source of inspiration and information for those suffering from this condition. Anna's story. Anna, a young mother and office worker, noticed that after regular manicures, her skin around the nail on her thumb started to hurt and turn red. Initially, she didn't pay much attention, thinking it was typical irritation after a manicure. However, the pain intensified, and pus soon appeared. I was panicked when I saw pus coming out of my finger. I immediately went to the doctor, who explained that it was bacterial paronychia. I was prescribed antibiotics and advised to avoid traumatizing the cuticle in the future. Now, I always monitor nail hygiene and choose only trusted manicurists. Mikhail's story. Mikhail works as a chef and constantly comes into contact with water and food. He began to notice that the skin around his nails was swelling and peeling. At first, he attributed this to dry skin due to frequent hand washing, but when the symptoms didn't go away, he consulted a dermatologist. The doctor diagnosed me with chronic fungal paronychia. I was surprised because I didn't think a fungus could have such a significant impact on the condition of the skin around my nails. I was prescribed antifungal creams and advised to wear gloves when working with water. The treatment lasted several months, but now my nails are healthy and I follow all precautions. The importance of prevention and lifestyle. Preventing paronychia is a key aspect of nail health care. Here are some tips to help you avoid this unpleasant condition. Maintain hand and nail hygiene. Regularly wash your hands, but avoid excessive contact with water. Use moisturizing creams for your hands to prevent dry and cracked skin. Avoid injuries. Never cut the cuticle too deeply and avoid cuts and injuries to the skin around your nails. Wear protective gloves. When working with water, chemicals, or in high humidity conditions, always wear protective gloves. Use quality manicure tools. Ensure your manicure and pedicure tools are always clean and disinfected. When visiting a salon, choose trusted professionals and monitor hygiene practices. Regularly check nail condition. Inspect your nails and the skin around them for changes such as redness, swelling, or pain. Seek medical advice at the first sign of inflammation. Support and resources. If you are dealing with paronychia, remember that you are not alone. Various resources and support groups can help you cope with this condition and find the necessary information. Consulting a doctor. Never hesitate to consult a doctor at the first signs of paronychia. Early intervention can prevent complications and speed up recovery. Online resources. Medical institution and organization websites provide reliable information about paronychia, its treatment, and prevention. Support groups. Social media and forums offer support groups where people share their experiences and advice on treating paronychia. The importance of knowledge and self-observation. Regular self-examination and attentive care to your body play a crucial role in the early detection and treatment of paronychia. A simple inspection of the nails and the skin around them can help you notice the first signs of inflammation or infection in time. Do not ignore even minor changes. Timely intervention prevents serious complications. Questions to ask your doctor. When visiting a doctor with symptoms of paronychia, it's helpful to ask several important questions to better understand your condition and treatment methods. What type of paronychia do I have? Acute or chronic? What treatment methods do you recommend in my case? How long will the treatment last? What precautions should I take to avoid recurrence? Do I need to take any medications, and how should I use them? These questions will help you get comprehensive information and prepare for treatment properly. The role of education and awareness. Awareness of paronychia and its symptoms is the first step in preventing and effectively treating the condition. Educational campaigns and access to reliable sources of information play a crucial role in raising awareness and educating people about proper nail care. Innovations in treatment. Medical technology is constantly evolving, and new methods of treatment and prevention of paronychia are emerging. Modern research in dermatology and infectious diseases is focused on creating more effective and safer ways to combat paronychia. Laser therapy. In some cases, laser treatment is used to help eliminate the infection and speed up the healing process. Biological preparations. New drugs based on biotechnology help fight infections more effectively and strengthen the immune system. Tips for maintaining nail health. Moisturize. Regularly moisturize your hands and nails, especially after contact with water. Protect. Use gloves when working with chemicals or in high humidity conditions. Proper nail care. Regularly trim your nails. Avoid aggressive manicures and pedicures. Healthy diet. Strengthen your nails from the inside by consuming foods rich in vitamins and minerals, such as biotin and zinc. Conclusion. Paronychia is a condition that can be prevented and effectively treated with timely detection and proper care. Understanding the causes, risk factors, symptoms, and treatment methods helps respond quickly to the first signs of the condition and avoid complications. Caring for your nails and the skin around them should be a part of your daily self-care routine. Regular self-examination, proper care, and awareness of paronychia will help you maintain the health and beauty of your hands and feet. May your nails be healthy and beautiful, and your life filled with joy and comfort without pain and discomfort.